The JCIPP, which is the acronym we use for our institute, is very pleased to be hosting today's Public Policy Forum with the support of our colleagues in the Faculty of Health Sciences at Curtin University and with Alzheimer's Australia, WA. The JCIPP is an institute within the Curtin Business School, and we conduct research, education and discussion in public policy and administration. And we regularly bring national figures to a Western Australian audience to discuss important public policy issues, and of course today's event is no exception. And I'd particularly like to welcome those of you who have not attended a JCIPP event before and trust that this will be the first of many. I would also like to acknowledge, the chairman of Alzheimer's Australia WA, but I think he's been stuck on the freeway, Craig Mazarai, and also two members of state members of parliament who are here today, Roger Cook, the Deputy Leader of the Opposition and Shadow Health Minister, and Margaret Quirk, Shadow Minister for Seniors. It's great to see such an important issue catching the eye of our state politicians. The format for this morning's forum is that our speaker, Ita Buttrose, will speak for about 20-25 minutes and will then be joined on stage by Professor Barbara Horner from Curtin's Centre for Research on Ageing and Frank Schaper, the CEO of Alzheimer's Australia WA, for a panel discussion and to answer questions from you, the audience. So get your thinking caps on now for some questions. But before I do that, I would like to invite the Pro-Vice Chancellor of the Faculty of Health Sciences at Curtin University, Professor Jill Downie, to the podium. Jill's had a long association with Curtin. She's been at the helm of the faculty since 2007, during which time she established the Curtin Health Innovation Research Institute and played a central role in introducing interprofessional education at Curtin University. Jill's recently been appointed the Deputy Vice Chancellor Education at Curtin, a position she takes up in late July, so we're really pleased and fortunate that she's here this morning in her current role as the Head of Health Sciences to introduce our speaker. So Jill, over to you.
Thank you very much, John, and it's great to see so many people here on a pretty wintry Perth day. On behalf of the Vice-Chancellor of Curtin University, Professor Jeanette Hackett, and Alzheimer's Australia WA, I'd also like to welcome you to this very special breakfast forum this morning. Curtin's proud to be partnering in this event. I'd also like to acknowledge the traditional custodians of the land, the Noongar people, and pay my respects to their elders past and present. Today's topic on dementia is a matter of significant importance. With an increasing ageing population, it's one of the biggest challenges we face as a society. It's the third leading cause of death after heart disease and stroke, and many of you here today have had some personal experience of this condition in some way, I'm sure. If we want to beat dementia and assist people living with this condition to maintain a quality of life, then research in this area is crucial. Curtin University, through the Curtin Health Innovation Research Institute, or CHIRI as it's known, is undertaking life-changing collaborative research in this field. CHIRI is all about developing effective research that can be readily translated into health policy and practice. CHIRI champions innovative, integrated and collaborative health research that encourages individuals to be active participants in the management of their own healthcare needs. CHIRI has a large number of research priorities, but a particular focus is on the area of ageing and dementia. Through the Centre for Research on Ageing, we're exploring new models of community-based healthcare to empower individuals and families to better manage their health. These strategies are particularly important given our ageing population and the need to maintain independence and reduce the levels of hospitalisation associated with ageing. We're proud of the fact that through the Centre for Research on Ageing, led by Professor Barbara Horner, we've been working collaboratively with Alzheimer's Australia WA for over 11 years. This successful partnership has led to leading research that has made a difference in the fight against dementia in terms of models of service delivery, approaches to care, issues for carers, workforce capacity and skills to improve the care of people with dementia and their carers. This partnership will be expanded and further strengthened with the Centre of Excellence in Dementia Care, which will be located at Curtin's Bentley campus. A further initiative of CHIRI, which will substantially increase our research efforts in the dementia field, is the establishment of the CHIRI Biosciences Precinct. This $35 million pioneering facility at Curtin will become one of WA's intense concentration of leading researchers in chemical, biological and pharmaceutical sciences, who will work together to develop urgently needed solutions to Western Australia's chronic conditions. Indeed, Curtin's bid for a new medical school is an initiative which will engage TUI research teams in undertaking clinical and applied projects focused on ageing and dementia. We want our doctors to be recognised for their strength in this area. And so, with these words, I'd like now to introduce our speaker for this morning, the renowned communicator and Alzheimer's Australia National President, Ita Buttrose AO, OBE. Ita Buttrose has twice been voted Australia's most admired woman. She has had a distinguished career in media and is currently chairwoman of Redo Media Services. She was the founding editor of Clio magazine, the youngest editor of the Australian Women's Weekly, and the first woman to ever edit a major metropolitan newspaper in Australia. Ita is the Vice President Emeritus of Arthritis Australia and patron of the Macular Degeneration Foundation of Australia. Her interests in health have included chairing the National Breast Cancer Centre's Advisory Network and serving as a director of the Prostate Cancer Foundation. She was made an Officer of the Order of Australia in 1988 for her services to the community, especially in the field of medical education and healthcare, including her work as chairperson of the National Advisory Committee on AIDS. She received an OBE for her services to journalism in 1979. Ladies and gentlemen, it's with great pleasure that we welcome this morning Ita Buttrose. Please join me in welcoming her.
Thank you very much, and good morning, everyone. I'm pleased to be here today to speak about an issue that is close to my heart. Our nation is facing a dementia epidemic. Currently, there are 280,000 Australians living with dementia, and this figure is set to rise to almost 400,000 in less than 8 years. Without a significant breakthrough, the number of people with dementia in Australia will reach more than 1 million by 2050. There are many forms of dementia. Alzheimer's disease is the most common form, accounting for between 50 to 70% of all cases. There are already 25,000 people with dementia living in Western Australia, and every day 18 new cases are diagnosed. The time to act on dementia care is now. Now, I know how important quality dementia care is for families and carers of people with dementia. I was the principal carer for my father, who had vascular dementia, the second most common dementia after Alzheimer's. And I know the tears and the laughter and the mixed emotions that are part of the dementia journey. And this experience has helped me to relate to what many families go through. I understand the stress and strain that this disease brings to family life. Dad's dementia was manageable most of the time, but upsetting because my brothers and I didn't like to see our father this way. I mean, he'd always told us what to do, and now we were telling him what to do, always tactfully, of course, so as not to upset him. And these are difficult times for a family trying to do the right thing by a parent. But somehow we coped, and Dad was happy in the strange place he often inhabited, and when he was back in the real world, he seemed content. He liked to walk around his garden, he enjoyed his tucker, he liked an occasional glass of red, a nip of scotch, and took to napping in the sunshine on his front veranda in the afternoons. And I think that all things considered, Dad's last years on earth were pleasant and comfortable. It didn't take me long to find out, however, that our health system is not designed for people with dementia. We do not extend dignity to people with dementia. Dad was in and out of hospital in the last 12 months of his life many times. And each time I had to explain to the nursing staff the needs of someone with dementia and to ask them to make a special effort in communicating with him. "Your father has been very difficult, quite unruly," a nurse said to me crossly one day. And it was as if the staff assumed that he was being deliberately difficult. And this happened every time he was in hospital, and it wasn't always the same hospital either. And I had to explain that when the routine of someone with dementia is interrupted, they can become confused, agitated, and sometimes even aggressive. And he was often cold. And again, I had to explain to the nursing staff that elderly people do feel the cold, even on the hottest summer's day, and often need extra blankets. In the last week of his life, when he was admitted to a private hospital in Sydney and required help to eat, the hospital told me that they didn't have anyone available to feed him his meals. Couldn't I arrange for his carers and his family to come in and do that? I was appalled. I mean, what kind of a health system is it that can't properly feed our elderly citizens who are hospital patients? It happens, and what happens to people whose families can't afford to pay for carers or who haven't got family members to do the feeding? Well, I know what happens because I've seen it for myself. A couple of my other older relatives, longevity runs in our family, were in nursing homes, and one was in an Alzheimer's ward. And I used to pop in to feed that particular relative on weekends, and I could see for myself that some of the residents weren't helped and consequently left their food untouched. And I used to tell myself there has to be a better way, and I still tell myself that. People often mistakenly think it doesn't matter what you do with people with dementia. They don't know what's happening anyway. Well, many of them do know what's happening. Not all of the time, but much more than people think, as I'm sure many of you would be aware. My experience is not all that different from the 1.2 million carers of people with dementia in this country, and the work and care of these dedicated people is largely unrecognised by most in the community. But I know how committed they are to providing the best care possible to the people they love, because as National President of Alzheimer's Australia, I've had the privilege of listening to people's stories, some positive, but many of them heartbreaking. Many stories of trauma and upset were caused by the difficulty in getting appropriate support, ranging from poor diagnosis, lack of information, and care services that had next to no understanding of dementia. All too often, the health and care system does harm to people with dementia. We need radical new settings in our public policy, not just because in the next 8 years, Australia is set to experience the greatest increase in the number of people with dementia, but because as a society we continue to allow a stigma to endure that devalues people with dementia from the moment of diagnosis. The Commonwealth Government's recent announcement that as part of its Living Longer, Living Better package, it has included an investment of nearly $270 million over 5 years to tackle dementia has not come a moment too soon. The reform package addresses dementia across the health and aged care systems and responds to many of the priorities that Alzheimer's Australia passionately advocated for in our Fight Dementia campaign. These include timely diagnosis of dementia. At the moment, it takes about 3 years for a person to be diagnosed once the first symptoms appear, and these are lost years when the person could have started treatment. The package also includes improved quality of dementia care in community, residential and acute settings, and support for younger people with dementia. And assuming the state and territory ministers of health agree, and surely they will, at their meeting in August, dementia will become a national health priority alongside 8 other chronic diseases, including cancer and heart disease. For the first time, we have a public policy framework for dementia that adopts a public health approach familiar to those who care for people with cancer and heart disease. It's no exaggeration to say that up until now, dementia has been regarded as the sole responsibility of aged care. The one priority that was not addressed in the Tackling Dementia package was increased funding for investment in dementia research. This is vital. We need to understand why people get dementia and why it impacts on the brain the way it does. As part of our Fight Dementia campaign, Alzheimer's Australia is asking for an additional $200 million to be invested in dementia research over 5 years. And it is our intention to push strongly for this additional funding as part of the government's current review of health and medical research led by former Australian of the Year Simon McEwen. Compared to other chronic diseases, dementia research is grossly underfunded in relation to health and care costs, disability burden and prevalence. In the 2011-12 financial year, the National Health and Medical Research Council for funding for chronic diseases was $160 million for cancer, $92 million for cardiovascular disease, and $71 million for diabetes. Alzheimer's disease and other types of dementia received only $24 million. Of course, we can't leave it to government alone. The wider community, corporations, and institutions have a responsibility to contribute to dementia medical and scientific research. Within Alzheimer's Australia, apart from our advocacy for increased dementia research funding, we are seeking to contribute to an increased research effort in 3 specific ways. Firstly, we have established the Alzheimer's Australia Dementia Research Foundation, which provides more than $1 million in grants to support new and emerging researchers. And this is important because the National Health and Medical Research Council tells us that the low funding levels for dementia are in part the result of insufficient funding applications. So we believe a priority must be to ensure that some of the most talented emerging researchers are attracted to dementia research to build capacity for the future. Now, over the years, we've had some success with this approach. Some of the better-known names in Australia dementia research started their careers with grants from the Foundation. Secondly, we have established the National Dementia Quality Care Initiative, which aims to improve the quality of dementia care in Australia by enabling people with dementia and their carers to get involved in dementia research activities, as well as supporting projects that promote evidence-based best practice dementia care. Now, this is an innovative project where people with dementia and their family carers who form the Consumer Dementia Research Network identify what they believe are the priorities in dementia care and are instrumental in determining what projects are funded based on information supplied to them by the researchers. And I'm delighted that one of these projects is being driven by Jason Burton from Alzheimer's Australia WA in partnership with the Who's Who in Design for People with Dementia. The Dementia Enabling Environments Project, DEEP for short, will provide information, training and assistance to family carers, aged care workers, designers and architects to help them to create gardens, buildings and interior spaces to make life easier for people with dementia. And this includes everything from paths to assist people to find their way back home, signage that helps them identify where they're going, plus simple measures that will reduce confusing noise and distracting clutter. 7 other projects have been supported through this initiative in a range of areas, including person-centred community care, relationships between staff and family carers, palliative care, and timely diagnosis. Lastly, and most importantly, in the context of this morning's forum, individual state Alzheimer's organisations are taking their own initiatives. And Alzheimer's Australia WA is leading the way with a particularly bold initiative. In 2001, it entered into a research partnership with Curtin University's Centre for Research on Ageing with the aim of improving dementia care in this state. The partnership has undertaken research to improve the care of people with dementia and their carers. One research project that has been completed is a study into dementia care in the acute care setting, something that would have been relevant to me when my father was in hospital. And it has resulted in recommendations and strategies to improve outcomes for people with dementia and their carers in the hospital setting, and provided suggestions for family carers to be involved in an integrated approach to care and discharge planning. It also highlighted the lack of awareness about dementia among acute care staff and the need for more education with an emphasis on problem solving and care management. This led to another joint research project that piloted a dementia training package for acute care staff in selected WA hospitals. It tested the appropriateness of such a training program and identified additional needs for education across a range of areas. Another research project, a pilot program for people in the early to intermediate stages of dementia, also involved their support person. It looked at ways to engage people with dementia in the community to optimise their quality of life through physical and social activity. And researchers found that such activities lessened the burden of care and improved the quality of life and the health and well-being of carers. The findings from these research projects were later translated into practice at Alzheimer's Australia WA through its client services, benefiting people with dementia and their carers. As a training organisation, it took these findings and adapted them into its education and training programs for staff working in aged care, and last year provided training to more than 7,000 people working in health and aged care. To enable quality dementia care to be extended to the 25,000 West Australians with dementia, the organisation also began partnering and working together with other service providers to implement evidence-based models of care. The success of this collaboration between Alzheimer's Australia WA and Curtin University has led to a further exciting agreement between the two organisations that will be of even greater benefit to people with dementia now and into the future. At the core of this new agreement is the establishment of a Centre of Excellence in Dementia Care on the university's Bentley campus, inspired by a similarly successful centre in Stirling, Scotland, but with a difference. Rather than just being a purely research facility, the new Centre of Excellence in Dementia Care will house Alzheimer's Australia WA's metropolitan operations and will provide clinical services to people living with dementia. The building itself will be a best practice example for an enabling and accessible environment for people with dementia. It will feature a purpose-built day and short-term respite centre where people with dementia can benefit from a setting that actively promotes social engagement and a sense of well-being. And it's envisaged that this world-class care environment will form the hub for the centre's research, testing and showcasing new models of dementia care, such as an artist-in-residence program and other non-pharmacological therapies. The next phase of our unique partnership, and we believe it is a world first, will combine Alzheimer's Australia WA's expertise in dementia care together with Curtin University's strong research background to develop and evaluate new models of care for people with dementia. By working together, we hope to be able to influence curriculum development with a strong focus on dementia care for students at Curtin University studying nursing, occupational therapy, psychology, social work, physiotherapy, pharmacy, and ultimately the proposed medical school. The students will also benefit from work placement opportunities in these new care facilities and support programs. The partnership will enable the next generation of allied health professionals to be equipped with a greater depth of knowledge in supporting people with dementia before they enter the workforce. And it's not just the health sciences that will benefit from the partnership. Architectural students will gain a better understanding of best practice design principles for built environments for dementia and aged care. This will influence the design and suitability of future aged care community and residential centres for people with dementia. Computer science students will be able to explore the increasing use of assistive technology in aged care in the 21st century. Art students will gain experience of using art and creativity as a therapy and an intervention for people with dementia. I believe that this very special strategic partnership between Alzheimer's Australia WA and Curtin University will be significant for Western Australia as we face the dementia epidemic. Such a vision requires joint support from governments, the private sector, the healthcare industry and the community as we work together to address this debilitating and chronic condition. Let there be no doubters. We will continue to raise our voice on behalf of people with dementia and their carers. Our advocacy will be focused on achieving a significant investment in research in the 2013 federal budget. We know we have to be single-minded to achieve our goals, but we also know that with determination and the support of people with dementia and their carers and the general community, we can succeed, as we did with our campaign for the Tackling Dementia package in this year's federal budget. It is an achievement of which we are quite rightly proud, and we intend to add to it. Thank you very much.
we're not going to let her get away just yet. That's why she's going to be sitting down here. We're going to get a chance to ask some questions in a minute, but before I do, I might like to ask our panel to come up to the table, and I'll introduce them as they're doing so. And they are Frank Schaper. Frank's the Chief Executive Officer of Alzheimer's Australia WA, a position he's held for 15 years. Frank's a very strong promoter of change and innovation and solution-driven outcomes, and he's strongly influenced the emergence of dementia care as a priority health issue both in WA and Australia, and he's facilitated the development of collaborative partnerships with a number of not-for-profit organisations, not just Alzheimer's WA, and was instrumental in the development of WA's Dementia Action Plan. So that's Frank. And Professor Barbara Horner. Barbara established the Centre for Research on Ageing, which has already been talked about, at Curtin in 2000, and she's been the director since its inception. Barbara's career includes considerable experience in industry and academic environments, and particular experience in aged care as a clinician, a consultant, a researcher and an educator. And as part of the Centre for Research on Ageing, she's also the director of the WA Dementia Training Study Centre. So that's Frank and Barbara. What I was going to do was to get maybe Frank and Barbara to make, just sort of say, for just a couple of minutes, some opening statements, and then we'll open it up to the floor. We'll have some microphones, and you're going to ask questions, and I've got a couple of questions in the back of my mind as well, in case you're not quick enough on the ball. So Frank, over to you first, and then over to Barbara.
Listening to Ita reminds me of the journey that we've been on. This has not been a short journey. It's been one that it's taken a long time, and sometimes I get very impatient and I want to see it achieved in the next 6 months or the next year, and then I realise that if you do it well, then it takes time, and you need to make sure that whatever you do is actually embedded in both organisations, that it's embraced by people both at Curtin and at our own organisation. They fully understand the journey that we're on, where we're going, and what the real vision is. And the beginning of the vision was that there is a reality around what we can and can't do as an organisation. We are a small organisation. Even though we boast about being the biggest in Australia, we are a small organisation in the context of the problem. And dementia, and in the sheer numbers that we're confronted with, is going to be a problem for society as a whole. And so any attempt on our behalf to try and embrace it totally and deal with the problem in totality is very foolish. And so very early in the piece we had to make a very important decision about where our future was. And whilst we haven't stepped away from being advocates, and we haven't stepped away from being strong promoters of good dementia care and making dementia, creating a dementia awareness in the community, we have recognised that we need partners in the community. And the first partner for us was Curtin University. There was a real reason for that. It wasn't that I happened to meet Barbara Horner in the supermarket on a Saturday morning, that we developed this particular partnership. It was because we recognised Curtin as having the largest number of health sciences students, and that had to be our focus. That's where we had to begin the journey. That was the group of people for the future we had to influence. So thus began the journey with Curtin. We started there. And I have to say they've embraced that very, very enthusiastically. And although it's a big institution and there are clearly little hurdles we have to overcome as we struggle along the way, I think in the main we've had what we wanted, and the pictures that you were able to see on the screen will begin to give you a sense of what it is that we're creating. It will not just be important for WA, it will be the second centre in the world of its kind. So our role will be to create a facility, to create a place, to create an environment that will give an example of what it needs, what other facilities, what other environments need to look like, need to feel like, if you want to provide good dementia care, so that the sorts of problems that Ita was talking about in her personal journey with her father are avoided. That we can actually get the community to understand what it is that you need to do in order to create and to be very good at dementia care. And even if tomorrow somebody invented the magic bullet and we could eradicate dementia, and let me stress, there would be nothing more satisfying for me than to learn of that, I still know that we have a 30 or 40 year journey ahead of us for those people who won't be able to take advantage of that and who will need to be cared for in some way by our wider community. So our role will be very specific. We will embrace working in partnership with others. We will help them to develop their skills in providing better care. We will become the place where you go to. We will build capacity in others. And the greater the capacity in others, and the more people we can engage in this partnership, the better will be the success of what we've created. And I can't speak too highly of the way that we've worked and developed this initiative with Curtin. And I think it's going to be an example for others to follow around the world.
Thanks, Frank. Barbara.
Thanks, Frank. I think the opportunities that Curtin has in this partnership have already been demonstrated. And when we did an exercise recently for the two organisations to, I guess, to demonstrate the outcomes of the work that we've done in this long partnership, and collectively through the work that we've done, we have secured some $6.1 million in research income. No, it hasn't all been specifically to each of the organisations, but in terms of the work that we've done, that's a pretty significant achievement for a community-based service provider who, when I started working with them, were not too clear on what evidence-based practice was, and certainly needed to work closely with us to understand how they could put in place policies and processes to ensure that could happen. And their growth is truly phenomenal, and it's actually an enormous privilege to be working with them over this period of time. And we've done that in a number of different ways. And these are examples of how organisations can work with universities so effectively in terms of someone working there 1 day a week and mentoring staff, through to joint appointments, through to research fellowships, and ultimately to what we want to achieve, which is a chair in dementia care. I think the growth and the opportunity for the staff at Alzheimer's is enormous, and we hope that this initiative will really open up more opportunities for them to become involved in teaching and learning, which is equally as important as research in this very important area. And also for our staff to have a clinical base in which they can translate their research, as well as an environment in which they can work with people with dementia and consumers and carers. So there are lots of opportunities for both organisations. I think the success of the partnership has come from the individuals who are involved and our collective passion to make a difference, but also because we are so committed to working with the many people who are touched by this condition of dementia. And even though you may not work in the area directly, there'll be very few of you in the room who don't know somebody, or have a mother or a father or an aunt or an uncle or a grandparent or a friend who's been touched by this condition. And it's one of those conditions that really engages you at the heart level. You really become involved, and we've all got personal stories like Ita's story and her experiences. So I think we've achieved an enormous amount, and I'm incredibly proud of the work that we've done. But I think we've got some enormous strides ahead in terms of other partnerships, engaging other organisations. There are lots of ways that people can become involved in this journey with us. And that's our role now, is to now engage with the wider community and to find other ways that we can engage people into this very, very important journey.
Thanks, Barbara. Now, where are my microphones? There's one there. So we've got some questions, and while someone's waiting to put their hand up, I've got a question for Ita. The incredible CV that Jill read out before about all the amazing work you've done on various health issues, and of course it's talked about the AIDS epidemic, if you like, first, and you've started, if you like, with the AIDS epidemic, and now we're here with the Alzheimer's epidemic. Obviously AIDS got a really quick attention right at the start almost. It didn't take very long in Australia to really wake up to the bowling balls, the whole thing. Alzheimer seems to have crept up on us as an epidemic, and it's out there. But as you said, in the health funding, etc., it's not quite really hit the public attention yet. Is there a reason for it, and how can we actually move to get that attention to the epidemic?
Well, I think the problem is that it's seen as something that happens to people as they age, and there has been a tendency just to write older people off as if they no longer have a contribution to make. I mean, I can remember a time once when I used to think someone 50 or 60 was old, and now I realise they weren't old at all. How it changes as we go through the years. But I think that is now changing because our organisation has been campaigning, and I think, as Barbara said, there are very few people, I think, in Australia now who don't know someone or haven't got a family member who's been touched by this disease, and that brings it more sharply into focus. But I think the thing I always ask myself is that what if it were me? How would I want to be looked after? What would I want? How would I want people to react with me? Would I still be treated like a person? Because even if you have dementia or Alzheimer's, there is still a person there, you're still an individual. And I think these are very important questions for everyone to ask themselves all the time, because we are living in mankind's longest period of longevity. I mean, and how do we all want to live? And we don't know what lies ahead of us. And so I think our thinking should always be coloured by that. And we should stop writing off older people as if they are of no importance.
Thanks. Okay, we've got a question over here.
I hear everything you're saying, Ita, and I agree, but how do we change the mindset of the health professionals who currently are the experts in this field to treat older people with dementia or with approaching dementia with some sense of dignity, and not just dismiss the fact that they're over 80, so you're old, so it doesn't really matter. It would appear that older people become apathetic about their health because they're expected to be apathetic about their health. And as family members, if you're active in wanting to get better care, you're seen as being pesky. So how do we change the mindset of the health providers to treat our elderly people with more respect?
Well, I think that's what this partnership that we've been talking about this morning is all about. That's all to do with changing people's attitudes and making people aware of the things they can do to make everything in life much better for people with dementia and their carers. I mean, it's a very important contribution to the debate. I can't solve all these things, and none of us can overnight because they've been around for so long, these attitudes. But I think the fact that we are getting dementia out there into the public arena, it is being spoken about. There is much more awareness about it. These are very positive steps. But it occurs to me that people who work in aged and healthcare often don't talk about the benefits of their job. Yesterday I ran into someone, I was at there was a lunch, a fundraising lunch going on here that I attended when I arrived. And somebody there who works in the field said to me, I really enjoy looking after people with dementia, because they surprise me on occasion. Well, I don't often hear people say that. And I think within the industry that we need to talk it up a bit. That just because someone has dementia doesn't mean they're not. It's not an enjoyable. It's not a job that you don't enjoy. I mean, there are benefits and pluses, and you would all know them better. People who work in the field would know them better than I. So there's that. It's wherever we all are in this particular fight. I think we all have to speak up a little more about what we do and why it's important and what we think, and we need to put the care of people with dementia into a much better bracket than we do. Carers are underpaid. We all know carers are underpaid, and I've certainly spoken out about that issue before. There seems to be a reluctance to pay people what the value of what they're worth. I said to John earlier this morning, if only we all played football or cricket, it'd be so much easier if we were a sporting organisation. Well, we're not a sporting organisation. We're people who deal with the mind and other health issues, and so we've all got a role to play.
There are a couple of things that perhaps you're not aware of, but I think there has been a really conscious effort to start to shift thinking in terms of care of older people within programs at Curtin, and the two that come to mind immediately, of course, one is the medical school, and I have the opportunity to work with a group of practitioners and researchers and CEOs to develop components of the curriculum that will ensure that our medical graduates will know how to care for older people, and in particular will know how to care for older people with chronic illnesses like dementia. And that will be a significant point of difference within that curriculum. Now that involves partnership with organisations to provide clinical placements, and we're now talking about how that can happen with these organisations and what changes they need to make as an organisation to be able to embrace students better. Another program, we've just been successful in obtaining funding to work with Rowthorpe through United Church Homes and Curtin to establish a teaching nursing home concept within that environment, and working with Dawn to expand her interprofessional education program. We'll have an opportunity to place students from different disciplines, and to do that we need to give them a good clinical experience, but we also want to show them that working in that environment is good, and they might think about going there when they graduate and not necessarily go to the traditional drama of the hospital. So I think there are lots of little steps you have to take to be able to shift thinking. I think you also have to work with health policy and with government to help them understand that that health is not just in a hospital, that healthcare is in residential care, is in community care. Our partnership with Silver Chain through my colleague Jill Lewin, and the work that we're doing with her team in developing a community-based program that will maintain the independence of people with dementia. Now that would be working with nursing and allied health staff. So there are lots of little bits to the puzzle. But I think one of our biggest struggles is to the community at large, because I still think that we have a lot of ageist attitudes within the community that have nothing to do with health professionals, that we've got a lot of work to do in terms of getting them to see the value of the older person. We still don't treat our older people very well.
While we're waiting, as we have two politicians here from the State Department, we talked a fair bit about the federal push, but we've talked about Alzheimer's WA here. Is there things the state governments can do? Maybe Frank, you've got something to say about that?
Well, I think, first of all, our relationship with the current government, as with the previous governments, Craig said last night, has been strong, and we've never been denied access, or we've always been able to talk about the issues we have. It's this uncomfortable divide between the two levels of government, where aged care, where dementia sort of sits, and I think our biggest struggle is within state government departments, where it's not so easy to get them to address the questions and to help develop programs. Now we have been successful with our acute care program, and I think with a small amount of money, in my view, we've achieved a great deal. But I think there are a whole range of other areas where state governments can play an important part. Housing for one, transport for another. They're very obvious ones where people with dementia and their carer struggle, where we don't have a housing policy that conforms with some principles around what's good design for dementia care. And good design for dementia care, might I stress, are also good design for living, and not just because a person's got dementia. When you looked at the building that we're talking about creating, much of that would be emphasising good dementia care, and yet, or a good dementia environment, and yet when you think about that in terms of a living environment, I wouldn't mind living in that myself, being in it, being part of it myself. So I think there are other areas that governments, that state governments can be involved in, and certainly I think there are a range of programs in the health portfolio where I believe we should have a much stronger influence and be much more involved in changing and shaping those programs and contributing to them in a real way.
Do you think, Frank, whether ministers, I'm going to assume that health ministers will agree to make dementia a national health priority, do you think that might be a step forward in perhaps changing attitudes in state government?
I have no doubt about it, but I'll give an example. Our current health minister, Dr. Kim Hames, was very supportive of the initiative when I asked him to support that among his colleagues. And then I was at a meeting with the health department, and a senior bureaucrat made the comment in passing that it never got up the last time and it won't get up this time. So there are these conflicting views about the priority and the importance of it. And I'm also staggered there are still some professionals and leading commentators in dementia who deny the numbers, who will argue that the numbers that have been, well, they're based on very good science and you know, they're well recognised across the world. They just refuse to believe because in their clinics or in their experience, they don't see that many people with dementia, therefore the numbers can't be high. What I think they don't recognise is that the phone calls that we get into the association, I've been struggling for 5 years with my father, I don't know what's wrong with him, and I can't get anyone to tell me what's wrong with him. Our GPs are failing people with dementia. We can't get early diagnosis. People are in the community struggling with this problem on a daily basis. They don't front up the clinics. They just battle on the best they can. They don't front up the GPs because they can't get any satisfaction there. So we still have an enormous struggle, an enormous battle. And I think there is a disconnect between political will and the bureaucracy, and I think we have some real work to do to overcome those sorts of problems.
Thanks. We have a question, Ben.
First of all, can I just thank all three speakers? I think this is such an important issue for all of us to deal with. So congratulations to Curtin for putting this on, and congratulations to Alzheimer's Australia and Curtin University for the partnership. My question is really to Ita, but the other speakers as well. Ita, the figures that you outlined are truly terrifying. We've got about 280,000 sufferers at the moment, 400,000 about 8 years you mentioned, and 1 million by 2050. We've seen in the last year or so in this country how difficult it is to increase taxes. The mining tax in particular in Western Australia has been a very controversial issue. Introducing the National Disability Insurance Scheme does have a national consensus at the point where everyone has agreed we should introduce the NDIS. At the moment there's discussions about a pilot for Western Australia. There's no consensus on how to fund it. My question is, how confident are you, and I guess to our two speakers from Alzheimer's Australia and Curtin, on building a national consensus around the likely cost of this, noting that we've seen, even in the last week, a state like Tasmania seeking emergency funding because it has an elderly population and required hundreds of millions of dollars of additional Commonwealth funding. The states are going broke, and I'm worried that if we can't get a funding base for the NDIS up, where we've got a political consensus, how on earth are we going to train the very many people we need to train through allied health at Curtin and elsewhere and get a political consensus? It just seems quite out of reach.
That's an easy one.
Look, nothing in life is easy. Absolutely nothing. We didn't expect, I have to tell you, we didn't expect to be successful in the 2012 budget. Every time we went and saw Mark Butler, the Federal Minister for Mental Health and Ageing, we even saw the Prime Minister, there was no indication. Mark Butler kept saying to us, there's no money, we're not going to change our minds, we're not going to restore it as an initiative, don't hold out any hope, just keep raising your voices. So we did, we just kept raising our voices. And I tell you, when I was lying in bed, the announcement of the $270 million package came on April 20th. And I was actually lying in bed, I turned on the ABC News radio, it was about 6 o'clock, and I thought, what did he say? Did he just say 270? And I texted Glenn Reid, our national CEO, because I knew he must have been. I said, I think I just heard we got funding. I said, I'm going to lie here again and listen to them repeat the headlines to make sure I heard it. And it was, he was in the same state. You know, we had no idea. So we know that, you know, if we mount an effective campaign, and that's true for everybody, if you mount an effective campaign and you get the people numbers, you can occasionally bring something off. In terms of the funding for the centre, that's really an issue for you two to hear about, which I don't know much. So I think you two should speak on that.
The funding of the centre is probably an easier answer than, and I'd say we're 80% there. So if anyone's got a checkbook with me today, I'm happy to pick up the other 20 of the $20 million we need to find. I think that I don't know how to answer the question, and I think it's a very legitimate one. But I think it's a broader question. And I think it goes back to valuing what older people can contribute to society. And I have been very privileged to work with national organisations in the Asia-Pacific Rim, in very disadvantaged communities where the availability of government money is not even an issue you can talk about because it's exactly that, it's not available. And where their priorities, where the communities and the government's priorities are at a very different place. And I'm talking about Pakistan and India and Bangladesh, and to a lesser extent Hong Kong and Singapore and Thailand. But I find, you know, Bangladesh is probably the place. When I went there, they said to me, we want to show you where we work and we want you to understand what your staff will be helping us overcome the challenges that we have and where we're finding there is evidence of dementia. They weren't trained in identifying people. And I walked for 8 hours through the slums of Bangladesh, Dhaka, and I will never complain again about the Australian health system or the Australian standard of living or anything at all that we have. And I don't think whatever bad it is, we have an opportunity in this country to overcome it. In those countries, but then I look at the organisations and I look at what they do with so very little. You know, you give them $300 and they can make that stretch for the next 6 months on a small project in some way that we wouldn't be able to do because we just don't seem to be as creative. I think that the future will, I absolutely believe that in the future we'll adjust. I have the same attitude to climate change. I think we will change as things change and we will adapt. We're very ingenious at doing that. And I think we'll be forced to adapt. And I think we'll be forced to confront dementia as a major health issue. And yes, the reality of today is that you could almost say that the world's broke. But, well, you know, you get very ingenious when something isn't there for you. You find other ways to do the things you want to do. That's also been part of my journey at Alzheimer's Australia WA. When somebody says no to me, that's always an opportunity for me to find a way to say, oh no, I don't take that. Say this.
Yeah, I'm glad you told us about the bureaucrat. If they didn't get up last time, won't get up this time. I've made a mental note now. I'll be very active on that one.
Just another comment I'd make, which I think is pertinent to the gathering today. You know, Ita and I both said that there are very few people in the room who are not affected or touched by this condition. I think one of the things we shouldn't underestimate is the power within the community. You know, there's an awful lot of us who are still voting, for whom there are some health issues that are really, really critical on the political scene. For me, one of them is dementia, the other is euthanasia. And those kinds of topics where we need legislative shift, and if we have legislative shift and we have public support and campaigns within the community to push those sorts of agendas, we've got a better chance of influencing government. And I've said for a long time, and you know, my dad who just passed away in February, said to me not long before he did, you know, don't stop fighting, Barbara, because, well, he said to me for years that this is the first time I've ever worked in anything that was of any use to him, which is to always make me laugh. A lot of that other stuff you did was really no use to me. But I think that fight, that we have a large sector of the population with a very big voice and a lot of knowledge now that we didn't have in the past, and it's actually our responsibility as much as it is providers and leaders just to shift public opinion and to force the issues into recognition. And the gathering here today, which, you know, Frank and I and Ita are delighted about, we don't think you all have, you know, a spare million in your pocket, but for God's sake, if you do, I get it before he does. But you all have a voice, you all operate in circles of influence, you all know people, you all talk about where you've been and what you do. And spreading the message about this initiative and its importance is also why we're delighted that you're here, because we now have a room full of people who understand this issue, this fantastic initiative and opportunity that we know over your dinner parties and other activities you will also talk about, and it's your voice who can spread the message and the importance of what we're trying to do here. So I think we as a community have a responsibility to make the changes that we want the government to pick up on too.
Got another one here? Oh, here. Thanks very much.
Look, I agree that we need to move, and we are moving with our health professionals and our attitude, but I think the other big thing...
Hold the microphone up to you.
The other big thing that we need to do is look at our community, and I think the dementia, we have got a stigma with that, just like we have with mental health, we have with dementia. And one of the gerontologists that I work with is reluctant and really thinks carefully about giving that diagnosis of dementia, because with that comes some downfall. If it's going to be a benefit to the individual, he's happy to do that and progress and test, etc., etc. But sometimes that diagnosis of dementia has a disempowering and a negative impact on the person. The daughter then says, Mum's got dementia, we'll put her into residential care, but she would have been fine at home managing. So there are disadvantages of having a diagnosis of dementia, and I think there is still a stigma in our society about dementia. Can you make a comment on how we can change that?
But there is a stigma, and I mentioned it when I was speaking. And you know, one of the reasons we think that it's a very difficult diagnosis to make. But I think it's also driven by what you just said. The doctor doesn't often want to make the diagnosis. Often the doctor has been treating the person for years and doesn't want to make the diagnosis. But I suppose as part of the campaign that we are now engaged in, that is one of our ambitions, to try to remove the stigma, to say there is no shame in having dementia. It's a chronic disease. You know, it's not a normal part of aging. It is a chronic disease, and that's why it must become a health priority. Because you know that's another step in trying to remove the stigma. And you know, again, people with dementia are now telling their stories, and these stories are really important because you can see, as I said, there is a person there, and they're still contributing, and they've still got views to say. You know, you don't just completely lose it when you get a diagnosis of dementia. I mean, some of your thinking might alter. We've got times when you're not particularly lucid, but there's still a lot of thinking going on there, and you know, so all of this is part of our program, but it's a very slow process, and that doesn't help anybody. But it is a slow process because we're really having to change mindsets.
And stigma is a big issue, undeniably, and remains to be like that. It's one of the reasons why we use people with dementia to front for us, to show that they still have capacities and they still have abilities. I guess on a personal level, it's a story worth telling. I was the first of 10 children to go back to Holland to meet the family and did all that stuff. And my mother's mother was in a care facility, and she'd been there for a while, and obviously my mother wanted to know that she was okay, and so I did the normal grandson bit and went and visited my grandmother, whom I now understand, I didn't then, had dementia. So my aunt was preparing me for the journey and said, look, she won't know who you are, and you know, she's forgotten all of us, and but she's very well cared for, and she's in a lovely facility, and you just need to assure your mother that she's okay. So I went in on a Sunday afternoon, there was another aunt and uncle there, and I walked in the room, and my grandmother's face lit up. She knew who I was. She talked about my brothers and sisters. She knew where we'd gone to. She knew about the things I got up to when I was a kid. I had this wonderful 20-minute window of conversation with her that she hadn't had with anyone in the family for years. And so there was something that made her connect on that day. And it happens for people with dementia. And you know, the things that have great impact, that remove that sort of stigma, or that makes it, that brings it to a different level. And I spoke about it last night when young Andrew Watts spoke at our 2007 conference. The first young man of 21, his father, a surgeon, had dementia. He told of his journey as a teenager, what he went through. You know, he got a standing ovation. It was an absolutely unbelievable 20 minutes to listen to. And it's those sorts of things that will help us remove the stigma. But is the journey, are we there? No, I think we're at the beginning of that journey. And I often, I often say we are at the stage where cancer was 20 years ago. And I think we will make up ground, but we've got a way to go.
Just when you asked the question, I was thinking, about 2 months ago, I went to a HIV/AIDS initiative, and I launched it for them about encouraging people to go to the doctor to find out if you had the virus or not. And the room was full of people with HIV. And I can remember when I first took the role on as chairman, people wouldn't touch anybody with HIV, they didn't hug them, they didn't anything. Well, there were lots of huggings and how do you do, and me too. I didn't have a problem, I must say, in the early days about touching people, but I know that was the way it was in the community. But anyway, a girl came up to me, she said, I've been living with HIV since 1988, 89. And I said, you're looking so well. I said, and she said, yeah, we met and she told me where we met. I said, yes, I remember that. And I said, well, you really look well. She said, yes. And she said, I've got a terrible cold. And I said, a cold? The fact that they were HIV was no problem. You know, the thing that seems to have gone. But a cold, now that was a really worry. But it does happen. Oh, no. You can get rid of it. You know, it just takes time.
We've got a question over here.
Thank you, and thank you for such an inspiring morning. I just wanted to say something about the 1.2 million carers that are looking after people with HIV, looking after people with dementia, far less with HIV, yes. To say that can't we harness something there in terms of the political voice? Many of those are voters, and somehow or other, whether they're so undervalued and underpaid and so busy 24/7 that we're not harnessing that voice somehow more strongly than we are. I just wonder what your comments might be on that.
I think actually Alzheimer's is doing that very effectively through their consumer networks and the engagement of carers and consumers. That's been hugely successful, and Ita might want to refer to that too. But you're right. I think there are many voices out there that collectively can shift thinking and make a difference. I think family carers are taken for granted by lots of people, health professionals included. And we all know that if they weren't there, that the cost of care would be significantly more than it is. And a lot of the time it's because the carer just gets on doing what they're doing because that's actually what they feel they want to do. So yes, you're right. I think we can engage that voice, and I think that that journey's begun, and there's some more work that needs to be done on that.
Yeah, I mean, you've got to remember that caring for someone with dementia or Alzheimer's is very demanding. There's not a lot of respite care for carers, and sometimes they're very much at their wit's end. We meet them when we have consultations, and you can see they're almost at breaking point course it's a hard journey at times. But they are very supportive, and I think the fact that last year when we had a march on Parliament House in Canberra as part of our Fight Dementia campaign, 500 people with dementia and their carers joined us from all over Australia, people and their friends, and it was an amazing sight to see everyone marching with our banner up to the lawn, up to the front of the Parliament, and listening. And that was a very big effort on their part. So the carers do their bit. They really do their bit, but they're giving their all to the person they're caring for. So whatever we can get out of them, whatever the cause can get out of them, is really a very big effort on their part.
Right, well it's just about 9 o'clock, so can I ask everybody here to join with me in thanking our panel speakers.